Speech off.
Hey you guys, welcome to my channel, or welcome back. My name's Emily, and I thought in today's video we would talk about getting a mental health diagnosis and what my journey to that was. So I really started struggling with my anxiety. I was diagnosed with generalized anxiety disorder officially, I want to say in November by my current therapy practice that I go to. And so I started seeking out treatment for my anxiety when it got really bad, probably in early September. And I just went up to my mom and said, hey, I've really been struggling. I've been getting really anxious at school, struggling to focus, getting more agitated easily, just really getting anxious in situations that I've previously had been finding easy to get through. And so at that time, I was seeing a pediatrician, and I'm going to leave the pediatrician's name and the name of the office out of this video for sake of privacy. So I went, we had this conversation on a Friday, and I went in on a Monday. And because I had school, my mom called and made the appointment, and so we went into the clinic, and basically they said, because I was in the middle of a panic attack, so I was having some chest pain and some trouble breathing, and so they were going to run some tests to make sure that it wasn't a ongoing chest issue that was causing me to have these symptoms. But they did I forget the name of the scale, I think it's called the GAD scale, or the generalized anxiety scale, but I could be wrong. But they basically made me fill out this questionnaire to judge my anxiety, and it was beyond high. They basically said, you have anxiety, but because you're 21 and you turn 22 in 8 months, we don't have the time to put you on medication and get you regulated on a antidepressant, but we will and we can't, because we're a pediatric office, we can't prescribe anything like Xanax or anything like that. But we will make sure it's not any other medical issue. And I walked out of that office knowing I was never going to go back, because I felt like I was struggling and they weren't taking my mental health seriously. The only good thing they did for me was give me the number to a therapist. They basically gave me a number to the therapist and said, you probably need medicine, but we don't have the time to help you. And so I went, they ordered a chest x-ray and an EKG. And so we went over to the diagnostic center which is the place where they do all these kinds of tests. And they did the testing, and during the EKG, my heart rate was really high. So they sent me over to the emergency room to get some more testing done. And that was just a really hard experience for me. And during that visit with the emergency room doctor, he was like, yeah, it's time you change primary cares to someone who's more understanding of the fact that you have anxiety. And but your chest and everything looks fine. They ran some precautionary blood work and pretty much made sure I was out. Basically gave me some medicine to help and things like that, and discharged me. And I switched into I was able to get I had some issues with my insurance, getting onto a doctor who was in that same health system that my insurance would take. It was basically finding a doctor who was in that system, like in the system for my insurance, that was in the practice. So that took some time, but we did, and we switched me into the adult division, and I made an appointment, and immediately this doctor was really compassionate and was like, you have anxiety, it's obvious, it's severe. What the emergency room gave you is only temporary, and we talked about our options, and I had a therapy appointment or an evaluation that was a couple of weeks out. And so that's when we had the conversation of, a lot of people have to take anxiety medication for life. There's no shame in it. And so I started taking Paxil, and it's worked really well for me. Mental health medication is not a cure. I believe it helps your brain get clear enough to be able to start therapy and be able to work through and find coping mechanisms for what you're going through. And so then I had the therapy evaluation probably in October, where it was me and one of the supervising therapists, I believe, or one of their lead team members. There's a couple people at the therapy practice that I go to who do all the evaluations. And then probably a week or two before Thanksgiving, I started actual therapy. And it has been a life sent or God sent, whatever you believe. But for me, it was a God sent, just be able to talk to somebody else about what I'm going through and being validated and talking about different coping ways to get through that. And so that's been really helpful for me, and I've been in therapy ever since, and I think I can be in therapy until March or April. Not sure exactly when that cutoff is, but yeah, then I might extend it. We're just gonna have to have that conversation, but I wanted to make this video just to tell you that, I always try to keep a happy, upbeat personality, but anyone can be struggling with anxiety or any type of mental illness. Check in on your friends. If they're acting weird, ask questions, and if you're feeling off, like something's going on, go talk to your doctor. If they aren't treating you right, go find another doctor, because someone will be compassionate about the situation. So that's just what the point of this video was. So thank you for watching, and be nice to anyone in the comments who shares their mental health journey. Have a great one.
Speech on. Transition to it. Back. Transit. Back. Stop. Recording. Stop. Button.